Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Okay, today's trick is the vanishing business or appointment card. We take a pen and we tap the card 3 times and it will vanish right before your eyes. Here we go. 1, 2, 3, and wait a minute, the card is still there, but the pen is gone. So how did we do that? Let's try again. Okay, the pen was not supposed to vanish, so let's try that one more time. 1, 2, and guess what? The pen didn't vanish that time, but the card did. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Well, that was kind of a fun trick using either a business card or an appointment card. And when you go to the website to learn how to do that trick, what you'll find is it's a sucker trick, because you say you're going to make the card disappear, you tap it once, twice, and the third time you tap it, the pen disappears. Then you explain to the person exactly what you did, only the explanation doesn't help them a bit, because the next time you do it, you tap the card once, twice, and the third time the card disappears. So it's a fun trick, and I think you'll enjoy it when you go learn the trick. But in the meantime, since we're talking about a trick with a business card or an appointment card, before you give the card to the person, why don't you do that trick? Say, okay, let me tell you why I'm giving the card to the patient. I'm sure many of you have gone to courses by practice management experts, and they say the best thing to do if you have a long, complicated procedure like a root canal is to call that person at night. Now, I don't know about you, but most of the time I hate calling people at home at night if I don't have to. And I think the majority of dentists would agree with that. In fact, most dentists don't even like talking to the patients. They would prefer that the answering machine pick up so they don't have to talk to them. So what I did, I tried that trick after listening to a practice management expert, and I did it almost an entire week. Then I got tired of it. I gave it to my secretary, who then promptly turned that job over to my assistant, who apparently turned it over to an animal, a dog in the office or something, because they referred to her as Rover. I don't know. But then Rover gave it to the hygienist, who didn't want to do it either, so she gave it to the UPS guy, and who knows what happened then. But nobody ever called the patients after about 3 or 4 weeks. However, here's a good trick. Tell your patient, today we've done a procedure, and you may have some pain afterwards. It won't be bad, probably a 2-aspirin toothache. But what I'm going to do is I'm going to give you my personal unlisted home phone number. And I want you to take that number, and that way if you have any problems, you can call me day or night, and I will be there for you. Now, the interesting thing about that, when I started doing that, no one called me. Prior to that, they would hire a detective, find out my unlisted number, and hunt me down Sunday night and get me over to the office. But they didn't do it because I was so nice to give them my unlisted phone number. Nobody does that for them. So now they're your friend. And if people like you, a lot of very nice things happen. They show up on time, they pay their bills, they recommend you to their friends, and the best part is they don't sue people that they like. So try this trick. Write your unlisted number on the back of the card, and then just before you give it to them, say, let's try a little trick. We're going to see if we can make that card disappear, and go to the magic trick we showed you earlier. Anyway, tell the patient before they leave, I expect you to have a 2-aspirin toothache. Take what you normally would take for a headache. If you need something stronger, you've got my personal home phone number, unlisted number. Call me anytime, day or night. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.